Welcome to Living the Dream for General Practitioners, the podcast for doctors and clinic leaders who want to learn about pathways, strategies and opportunities for living and working in Australia. Join me, Gemma Goff, and my expert guests as we share stories and unlock the secrets to recruitment success. We share tips for moving across the world, navigating new cultures, and so much more. This show is brought to you by Health Recruitment Australia. Now sit back, relax, and enjoy this episode. Hello everyone, and welcome to Living the Australian Dream for General Practitioners. My name is Gemma Goff. I am the co-founder and managing director of Health Recruitment Australia. Today is our first podcast in our new Clinic Leaders series. Each week I will meet with clinic leaders from across the country to give them an opportunity to showcase their clinics, highlight key GP vacancies, and share with you why their practice is the business to join and why they choose to work with Health Recruitment Australia and the benefits this has brought them. Today, I am delighted to be joined by Dr. Grant Baker and Brett Size from Pro Healthcare. Hello to you both. Welcome.
Hello, Gemma.
Hey, Gemma. Thanks for having us.
Oh, it's a pleasure. All right, let's jump straight into some questions. So perhaps you could share with our listeners a little bit about yourselves, who you represent and what your positions are, how long you've been there, and anything else you'd like to share with our listeners.
Gemma, I'm Grant Baker. I'm a GP. I was an ex-rural GP. I moved back to Adelaide about 12 years ago. That's where I started working with Pro Healthcare and have been an owner of two of the clinics at Pro Healthcare for near on 8 years.
My name's Brett. So I've been with Pro Healthcare for the past 3 years. Initially came on board providing human resources support to the Pro Healthcare network of clinics. Recently moved into more of an operational role, which is very exciting. And look, joining Pro Healthcare, it's just truly been a pleasure supporting practitioners and business owners who really put people and healthcare first. At its core, Pro Healthcare is practitioner owned and operated, which I think makes a really big difference, especially when it comes to healthcare. And look, compared to other industries and other businesses I've had the pleasure of being a part of, big positive for me is that Pro Healthcare is also quite forward-thinking when it comes to technology, software, anything that comes in which or is released which might be of a benefit to the patients, the staff, or the practitioners. I'm very happy to look into and trial. So examples of that would be the evolving space of AI or the intelligence platform Cubico. Pro Healthcare is very hot on it in incorporating that and giving access to the practitioners. Before Pro Healthcare, I spent quite a few years in mining and civil construction. So healthcare has been quite the sea change for myself. And look, when in mining and civil construction, great experience. And I was fortunate enough to see a lot of regional remote places throughout Australia, which I guess not a lot of people have the opportunity to do so.
No, it's amazing. Thanks for sharing that with us, Brett. How about you, Grant?
I'm a GP. I was an ex-rural GP, moved to Adelaide about 12 years ago where I started my relationship with Pro Healthcare. Have been an owner of our sister clinic at Mitcham for 8 years and obviously at Aldinga, where we're trying to recruit to for just over 12 months or so. I'm also a medical educator, involved in teaching. In a former life, I've done anaesthetics, obstetrics, you name it.
Amazing. Quite a variety. Good on you. Excellent. So maybe tell us more about your practice, the ones that you're wanting to promote today. So sort of location, tell us whether there's mixed billing, bulk billing, community, is it a growth area or not? Share with our listeners as much as you can about your practices.
Aldinga is probably about an hour south of Adelaide in the Southern Vales wine region where that meets the sea. It's a beautiful location. I live in Glenelg, a beachside suburb of Adelaide, and it's a 30-minute commute down a new freeway to the practice. The bricks and mortar, it's a beautiful laid out, spacious clinic with 12 consulting rooms. One of the ethoses of the Pro Healthcare is the multi-disciplinary approach. So we have in-house physio, podiatry, dietitian. We're about to put in a gym and get some exercise physiologists involved. It's got a really good feel, still in an area of need, but an easy commute from the city. And the village of Aldinga is lovely. It really is.
That's great. Brett, did you have anything you'd like to share about the clinics or the area or the team?
Yeah, absolutely. So I guess building on what Grant's mentioned, so the Pro Healthcare Aldinga Clinic is a sister clinic to the Mitcham practice, and joined the Pro Healthcare network, I think it was late 2023. The previous owners there were looking to take a bit of a step back and move towards retirement. So it was previously known as the Ryland Medical Centre. Now it's Pro Healthcare Aldinga. As Grant mentioned, it's a beautiful clinic. Amongst the Pro Healthcare locations, it's probably at the top of my list. Has a lovely beach feel to it. It's very open. It's purpose built. It's mixed billing. It's currently a day clinic, Monday to Friday. As Grant said, 12 consulting rooms. We've got 10 GPs practicing there currently, all in various capacities. One of the big things with Pro Healthcare as well is the flexibility to consult the session times which best fit your lifestyle, whether or not that's doctors that want to work 5 days a week, or doctors that want to work 3 days a week to fit in other hobbies and other interests. We've got a really good team there for, I guess, tenure and things like that. Most of the GPs, or the average GP tenure at the clinic, is 23 years, and for administrative staff is 12 years, which I think is just a really good testament to the team and the culture that the previous owners had, and that we've managed to carry on and build upon since the change of ownership. It provides comprehensive general practice services, a lot of chronic disease management, skin cancer clinics, minor surgeries, and we're roughly about 30 k's from the nearest hospital. As Grant mentioned earlier, he's very heavily involved in being a medical educator, supervising GP registrars, and Pro Healthcare Aldinga is a training practice which supports that. So we're very hot on supporting, I guess, the next generation of medical professionals in Australia, whether or not that's those going through the Australian GP registrar process, or even international medical graduates looking for a bit of a sea change as well. And the practice itself, a big thing for us is wanting to increase the number of GPs that we have available there, extending the practice hours, and as Grant mentioned, doing some exciting things like putting in a dedicated gym space just to provide some extra allied health services to the community there.
That sounds amazing.
Aldinga is a massive growing area. There's several new housing developments, some new schools going in. Its growth and potential is just booming. The other thing, we have every session we have 2 nurses on to assist with dressings and immunisations and procedures and chronic disease management as well. So it's a very supported environment to work in.
Which is really important for GPs who are looking to come from overseas. It's particularly those from the UK, for example, where they're used to the NHS model. This is very different. So to have that established team there to offer the support is really important to them, and something they often ask us as recruiters, is that available for them? So that's good to hear.
It's a very, Aldinga is the clinic compared to some of the other clinics I've worked in and been a part of. It's a very collegiate feel. Like they have an hour for lunch, and once a week they'll have a team quiz where the ex-practice manager will send in some quiz questions, and we all sit around the lunch table and scratch our heads and try and come up with the answers. But it's a very supportive, collegiate feel to it. So for a new practitioner coming in and into a foreign system, because the flexibility of the Australian system is completely different to the NHS, and I can understand why people might wanting to be leaving the NHS and come to our flexible Australian system. It's a very supportive place to come.
Absolutely. And there's, particularly the GPs we're talking with in the UK at the moment, they are reaching that burnout. They're not even getting a lunch break. So just the idea of having a lunch break, let alone one with their peers, is, just music to their ears.
Well, that's one of the things that Brett mentioned about the flexibility. So, who are we looking for at Aldinga? We're basically looking for, it could be somebody that's coming towards the end of their career and they want to see change. They want to spend as much time in the local wineries or out surfing as they do in consulting. Or it might be a young general practitioner that's starting out that wants to have the blank canvas, which really Aldinga at the moment is, under new management. And we are looking at growing and expanding it. And so somebody, the right person, gain some ownership and create a practice in their image. So it's got opportunities at both ends of the spectrum and probably a whole lot in between, that flexibility.
That sounds amazing. What does a typical day look like at the clinic? So, Grant, you're a GP. What does the day look like for you? A typical day in the life of a GP in Australia?
Yeah, well, it's varied because of that flexibility. There's a lot of part-time GPs, but for somebody like myself, the practice is open from 8 to 6. I generally see my first patient at 8. A lot of the other doctors will start at 8:30. There's a couple that'll start at 9. We'll consult through until about 12:30, and then lunch is from 12:30 to 1:30. The last patient I see is at about 5 p.m, and I'm out of the practice with nothing more to do at 5:30 p.m. That's it, done for the day. And generally a full-time GP in Australia and in our practice system will do 8 sessions a week, 4 days a week, and have a complete day off. So it's, as we're saying, and that word flexibility, you can choose to work as hard or as little as you want. Obviously, the more work you do, the more you earn. But all about life, there's more to life than working and making money. It's nice, but it's not the be-all and end-all.
And we have got a lot of interest from GP partners at the moment in the UK. So they're acknowledging that they're doing all the patient consults during the day, and then the evening is all the admin, all the paperwork, the partnership meetings and things like that. So it sounds to me that that's not something that would necessarily be a requirement here, that you're home by 6, you have dinner with a family and a walk on the beach and just enjoying those beautiful evenings.
Well, that's one of the things about the pro healthcare model. So I'm a part owner in Mitcham and a part owner in Aldinga, but we've outsourced HR to Brett. We've outsourced finance. And the pro healthcare organisation, we pay a service fee for that, but that's all done for us. Yet we're still an owner and decide how the practice runs and things, but we don't have all that burden of excess work. We've outsourced that. I think it's a great model. I've been a rural GP where I used to do exactly what you said, Gemma. Work all day, consulting, and then work all night on the practice. And that's why I've got all these grey hairs.
Yeah, that work-life balance that everyone dreams of.
Absolutely.
Yeah, good on you. So you're currently working with Health Recruitment Australia to onboard additional GPs. Can you share with our listeners why this is? Why you're looking for GPs? Is it growth in the community? Have you got some attrition? What's your reason for recruitment at the moment?
I might have a first crack at that, Brett, if that's all right. The practice, we took over the practice about 12 plus months ago, and the previous owners were looking at stepping down and retiring. A couple of the other GPs moved to the city just for a whole variety of different reasons. So the practice took a little bit of a haircut in relation to GP numbers, and the southern Fleurieu area is just growing rapidly. So we've got a decrease in GP numbers, an increase in patients or potential patients, and we're looking at growing the practice back to its former glory, where it used to be open on a Saturday and a Sunday. The beauty of the Australian system is it's only if you're willing and want to. No one's forced to do anything. You don't have to just work on a Saturday or a Sunday. It's an opt-in rather than an opt-out.
And I assume GPs that were perhaps looking to work through the sort of out-of-hours sessions, is that an option for them? You know, if they've got a partner that works in the day and so they might mind the children, and then, you know, they might want to come do some evening sessions, you know, rebates from Medicare and such like would be perhaps a better value for them. So is that something that Pro Healthcare is open to?
Absolutely. I think a bit like I was saying before, for a young person, a young GP, or anybody really that wants to grow a clinic, and it's a blank canvas, and there is that ability to do that. That's what we're looking for, somebody at that end of the spectrum that is keen to work and grow and mould a practice. Also, the other end, somebody who's in the sort of the wind down phase. It's and anything in between.
Amazing. Brett, maybe you could share with us, what does your ideal candidate look like? Are we looking for VRs? Are you open to non-VRs? Brett's mentioned, you know, you're sort of fairly flexible in terms of what hours the GPs would like to work, but perhaps your demographic, you know, what sort of special interest perhaps would the GP would be needing?
Yeah, absolutely. So our ideal candidate would be a VR GP that's really passionate about comprehensive patient care and interested in being a core member of the practice, including, you know, potential future partnership opportunities as well. And as Grant mentioned, since it does have such a collegiate feel there at the clinic, with the, you know, everyone having lunch at the same time, participating in you know, quizzes, we're really wanting to continue building upon that. In terms of special interest, and Grant can probably add on to this afterwards as well, but it is at the moment anyway, it's a bit of an older population, although that is shifting with all the state government developments in schools and the highway. So chronic disease management interest is certainly beneficial. Skincare is another big one. There are a lot of expats from the UK which have relocated down to the area, so we do see that pop up quite a bit. But to be honest, since the region and community is you know, growing so much and forecasted to continue to do so, the population base and the presentations is doing the same thing. The big thing for us is probably really just looking for GPs which fit into the team and culture that we have, which is very supportive. And also, look, a big plus would be if they are interested in providing supervision to GP registrars and other future medical professionals, such as international medical graduates, or have experience already doing that type of thing. That would be a big bonus for us. But really, as I think we've said, we're quite flexible. We're really happy to work with people, whether or not they're VR, non-VR, if they're looking to, you know, start their career or wind back. We're in a very fortunate position where we can really make something great with anyone that we work with.
That sounds amazing. That sounds really good. I think the key in terms of the community there we were talking about, this is a real sort of cradle to grave kind of community, isn't it? You've got pockets of the older community, but you've got lots of young families moving to the area, having their children. I believe there's new schools built in the area and, like we said, lots of housing, but there's also that whole infrastructure to support that growth in the area as well, which is important to share.
One of the things with the Australian general practice system, a lot of the GPs, apart from their what I'd call their standard consulting, also have areas of interest, and whether that's chronic disease management, counselling, addiction medicine, respiratory medicine, skin cancer medicine. You know, we've had a GP in the past that's interested, was a former ophthalmology trainee, so, you know, with a slit lamp, and they've developed that side to their practice. So generally, lots of GPs will have an area of interest, an area of specialisation, which they might spend a day or a session or two in that, and that's something that happens in Australian general practice and something that we fully support.
And is that something that perhaps Brett and the support team would sort of help promote those services within the community as well? So if a GP wanted to do, you know, set up skin cancer clinics, for example, that's something that there would be sort of social media campaigns and mails out to the community and the GP can really make a real good go at that sort of new service.
The beauty of being involved in the Pro Healthcare is the marketing team that we've got access to, Brett.
Yeah, exactly right. So I guess that's one of the big benefits compared to, I guess it's a good middle ground, I think, the Pro Healthcare model. On one hand, you've got, like Bart mentioned, being a rural GP and you're doing it all. And that's, apart from the effect that has on your personal life and your work-life balance, being a jack of all trades sometimes isn't as effective as being able to outsource things to specialists in the area. And that's where Pro Healthcare comes in. So it's kind of in between an individual practice or, a larger corporate. It's the nice, happy middle ground. We've got a dedicated marketing team, quite a strong social media presence, whether or not that's on, Facebook, Instagram, LinkedIn, quite a few other platforms as well. And we also have, we've got the dedicated team with expertise in the area. They do e-marketing campaigns, SMS campaigns, pretty much everything under the sun to try and promote new services and new offerings for the clinics.
Amazing. And that just enables the new GP to come in and really spend some time to build their relationships with the team, with the community, and essentially working smarter and not harder. Let those that are good at what they do, i.e. the marketing team, do the marketing, and leave the doctor to do what they're good at and promoting their special services. So that sounds perfect. That's great. So we've talked about the kind of GPs that you're looking for at the clinic. So, Health Recruitment Australia will continue to send CVs through to you guys for consideration. We work with you and we arrange times for you to meet with the GPs for interview, usually through Zoom or similar platforms. What is it that you're offering GPs, after the, the interview and you're keen to recruit this GP? What is on the table for them to pick Pro Healthcare as their clinic of choice?
Grant, did you want to lead this one? Are you happy for me to lead?
I'm happy for you to lead that one. I can offer my knowledge and around housing, schooling, transport, how the clinic works, how the Australian system works. And I know, Gemma, in a few of the interviews we've done recently, I've spent a bit of time explaining how the Australian healthcare system works and how we fit into that. But as far as support, Brett, you're probably in a better position.
Yeah, perfect. So Pro Healthcare and Pro Healthcare Aldinga, a bit of a rehash, but outside of the purpose-built facilities, flexibility, professional autonomy in your role, in addition to that, we're happy to look in supporting as far as visa nominations and sponsorship, if that's required. We offer very attractive remuneration packages, and that includes things like short-term accommodation for a few months to help support your transition to either to Australia if you're coming from overseas, or to Adelaide or the Aldinga local region if you're just moving, interstate. We do look at sign-on bonuses, which are, lump sum incentives, and also, hourly security nets as well for the first few months as you find your feet and start establishing yourself within the practice in the local community there. For those interested in practice ownership in the future, there's potential for that kind of conversation as well. And we also offer a full suite of complementary professional development support too. Whether or not that's looking at subsidising special interests, which would be a benefit to the practice and the local community. We also do free in-house CPD opportunities. So we do a big Pro Healthcare wide annual professional development day, which all goes towards that. And that's GP-led, GP-organised and GP-driven. And we also do monthly complimentary virtual peer-to-peer education sessions as well, which contribute to that. And give access to, intelligent practice analytics and things such as Cubico for those that are really interested in trying to fine-tune their practice and how they're servicing their patients. To give a rough idea of, I guess, the average VR GP billing for Pro Healthcare or Aldinga in the area, for a GP working, let's say, 40 hours a week for 48 weeks of the year, allow for a bit of time off there, it's about $600,000 per year that they'd be billing. The take-home amount does vary depending on, if someone was to come on board as an international medical graduate compared to a VRGP, the arrangements and agreements in the background do vary a bit. And then, take into consideration local government taxes and so on. But regardless, billing that type of amount with the flexibility that is available, it's very rewarding. It's very comfortable. And, outside of that, there is a lot of, outside of pro healthcare support, there's a lot of support from the local team there, such as with Grant.
And having been somebody that travelled and worked in the NHS system for a little while, I know what it's like to pull a spouse and travel overseas, and then to try and move with family. It's all very scary and intimidating. And so, a couple of times with a few of the interviews I've had with English GPs, that we've had a couple of supplementary talks around schooling options and living arrangements and things. So there's that, we fully understand just how intimidating it can be to move across the world, and in that we're happy to have somebody come over and have a look and show them around, and Aldinga would sell itself.
Absolutely
it'd sell
beautiful
itself.
Location, yeah. And I think touching on the finances as well, as you mentioned, Grant, that in the NHS, GPs are generally salaried GPs, so they've got a set income that they know what how to live within their means, as it were. Moving to the other side of the world, where if you're not consulting, you're not earning. That's a scary thought for a GP, particularly if you're bringing, partners and young children and such like. So is there sort of education in terms of the MBS that is available for new GPs as well?
There is. But getting back to that point, Gemma, that's, like Brett mentioned, there's a sign-on fee bonus, and then there's a safety net, so that, whilst, you don't hit the ground running seeing 3 or 4 patients a day, per hour, it takes a little time to get used to the system. So there's that's built in, that level of support. So
yeah, for sure. And GPs generally, when they first start as well, it's quite common for them to see, the repeat prescriptions and the medical certificates and things like that until they build their own patient base and are eligible to build those chronic disease management items and things like that. And again, that's the sort of education these overseas GPs require as well, that, lots of support and lots of training. That's where software, Brett, like Cubico comes in handy for them as well. So they can see that there's certainly potential within your current patient base to earn a very lucrative income if they're working really smart.
Yeah. And I guess, as has been mentioned before, it is a training practice. So we're very familiar with working with GP registrars, for example. We've got 3 GP registrars at the moment at Aldinga. So we're very familiar with, with those registrars, although they may have been born and raised in Australia and familiar with Medicare, knowing the actual intricacies of item numbers, how you bill specific things. The general population have no idea, don't need to, but, Grant and the team, they're very familiar with then welcoming, new medical professionals in and effectively training them from the ground up as to how it all works in the background.
That's great. And because, like we say, the medicine is trained, isn't it, overseas to here, the medicine is medicine, but learning Medicare and, the pro healthcare way and things like that is where the support's needed.
Yeah, it's often not the medicine, it's often referral patterns. Where do I send the child with a otitis media? Who's a good pediatric ENT in the area? Or, those kind of questions, which take time, to...
Yeah, no, that's great. Sounds very supportive. Yeah. So, Brett, you and I have been working together for a little while now, using HRA as the one of the recruitment agencies to help grow your pool of GPs. And perhaps you could share with our listeners what benefits you found to using HRA.
Yeah, absolutely. Look, working with yourself and HRA has been a big help. It's been very eye-opening, to say the least. Just even in terms of the different pathways and eligibility requirements for different GPs from different countries, different backgrounds. And look, for yourself, originating from the UK, you've got a very unique take and experience, very relevant to what we're hoping to achieve at Pro Healthcare Aldinga. And your advertising reach has really turned it up a notch from our end in terms of being able to actually meet with, or virtually meet with anyway, high quality practitioners that we think would be a great fit for the practice and team. So it's really just taken it up to the next level for us, and it's been a very exciting time.
That's great. Anything you'd like to add to that, Grant?
No, I'd just say some of the interviews I've done, I've been blown away by just the quality of doctors that are looking to come out from the NHS. Been excellent.
Excellent, that's great. And Health Recruitment Australia, we do a lot of screening behind the scenes as well. We've got just so many candidates on the books that, would be eligible to work in Australia, but we spend a lot of time working through each of those applicants to make sure that they're the right fit for your clinics. Health Recruitment Australia isn't a recruitment agency that would just put a bum on a seat. It is about finding the right fit for your practice, someone we think that will be a real asset to your team. So we hope that we've managed to do that thus far.
That's always been my motto. Just because you've got a medical degree and a pulse doesn't necessarily mean we want you working in our clinic.
Exactly right. All right. Well, is there anything else that you would like to share with our listeners about the opportunities that you have, about the location, about the clinics, anything at all that you think would be of value to our listeners in deciding whether Pro Healthcare is the business for them to join?
I think Aldinga is all about the opportunity and the flexibility. You can come and do a couple of sessions a week and spend the rest of the time surfing, or you can come and work towards developing a practice in your own image and, look at being an owner and growing a practice. As long as you're willing to work in a team, you enjoy the culture of living in and working in Australia, and you enjoy teaching, we'd love to have you at Aldinga.
Brett?
Yeah, absolutely. As Grant said, look, the area and the practice is just full of potential for many different approaches. And look, whether or not someone's looking to move to the Aldinga region, which is growing significantly and continues to get the government investment there, or towards Adelaide, which it's getting easier and easier to make the commute down there. Like Brett said earlier, he's based in Glenelg, and it takes only 30 minutes to travel from Glenelg to the practice at Aldinga. Look, it's a fantastic opportunity there, and we're really excited that we had the opportunity to get involved with the clinic in the region. And yeah, look, we're really just keen to speak with GPs that are passionate about making a difference, joining the team, and we offer a really welcoming and supporting environment to hopefully help you thrive and make the move to Australia.
That sounds really great. Absolutely.
Yeah, exactly. The Australian dream, I think it is, isn't it?
Absolutely. That's exactly what it's about. Absolutely. Well, it's been an absolute pleasure, Jens. Thank you so much for your time. I've really enjoyed genuinely getting to know more about Pro Healthcare and what you guys are offering GPs at the moment. So if any of our listeners are looking for more information, please reach out to the Health Recruitment Australia team, and we can put you in touch with Grant and Brett for more of a conversation. So that's it for now. That was our first episode in our Clinic Leaders series. Thanks everyone for listening, and I'll see you all again next time. Bye for now.
Beautiful. Thanks, Gemma. Appreciate everyone's time.
Thank you for listening to Living the Dream for General Practitioners. Don't forget to subscribe on your favourite podcast player so you don't miss an episode. At Health Recruitment Australia, we want to see more happy GPs, thriving medical practices and healthy communities. If you'd like to join us on our mission, visit healthrecruitmentaustralia.com.au to explore opportunities and to get in touch. Thanks for listening.